While much attention is being paid to the potential risks associated with the Ebola virus reaching Caribbean countries, including the Virgin Islands, past chairman of the BVI Medical and Dental Council, Dr. Mitchell Penn, says the chikungunya outbreak can be used as a dry run for the management of viral threats to the local population. The Ministry of Health and Social Development confirmed in March 2014 that Jos van Dijk had 7 cases of chikungunya, as well as 27 out of the 47 reported cases of dengue in the BVI. The former chairman of the BVI Medical and Dental Council applauded local health authorities for their efforts to address the viral outbreak, but says much more can be done to reduce the spread of mosquito-borne illnesses.
I applaud the members of the healthcare fraternity, especially Dr. Potter's team in the ministry, for their public health efforts. They've been on the ball in terms of what they have been trying to get the community to do. This is a community initiative. And I think that the over-reliance on government to solve the problem in the country and their efforts of trying to have a shared approach to fixing the epidemic is really, it's really applaudable. I would like to see some, government take a stronger lead in terms of perhaps mandating certain things to happen. How do you treat the largest water catchment that you have in all the residents in the country? Which you think that may be the source, but we're looking for these little pans of water around the house. When in fact, I think that the source may be the larger water catchment areas, and then that's where the community comes into play. Are you putting the screens on the outlets of the cisterns? Are you having the screens on the inlet of the cistern coming down from the roof? This is a dry run for the country in terms of what happens when epidemics break out into the country. Can that epidemic itself be a unifying force to get all hands on deck to help to clear whatever the vector is in the country? And again, the call goes out to service organizations to really get behind the initiatives. Private and public partnerships are going to be best to actually help to eradicate this menace that is actually triggering this challenge that we're having at this time.
Although there have been much media reports based on advisories from agencies such as the Caribbean Public Health Agency, CARFA, on the chikungunya outbreak across the Caribbean and Central America region, Dr. Mitchell Penn says what he has seen locally are hundreds of non-hemorrhagic dengue cases. He further dismissed suggestions that the virus is not being spread by mosquitoes and warned about the use of home remedies to treat a viral illness.
Most of what I have been seeing in the laboratory are dengue cases, non-hemorrhagic dengue. And that brings along one of the important questions. Why we're seeing so many persons picking up all sorts of, I call them rubbish remedies, to try to say that this remedy, this plant or that plant can fix a viral illness when there's no evidence for it. I have persons who wake up in the morning after sleeping in their beds. They wake up with broken arms or broken toe. They didn't remember going to sleep with it. Okay? When you are asleep, you know nothing. When you're dreaming, you're throwing, you're flailing, and your hand hits on something and it breaks. So if a little mosquito bites you in the night, you will not know. So surely you don't know that a mosquito bit you. But we have to let evidence run medicine, not just hearsay. Because this day is causing a lot more trouble in the country. Because the information is just coming from unvetted sources, and you can't even corroborate the data. This is 2014 BVI. This is not 1960 BVI. We have to really behave, like a modern society would.
According to the World Health Organization, chikungunya is a viral disease that is spread by mosquitoes. It causes fever, severe joint and muscle pain, headache, nausea, fatigue, and rash. To reduce the spread of mosquitoes and prevent mosquito bites, residents should keep tires in a dry place, punch holes in them to make sure water drains out, put plants that are currently in water into soil, empty flower pot bases weekly. Cover or turn food containers for animals and buckets that hold water upside down. Repair or replace damaged screens. Keep windows and doors without screens closed. Place a screen or mesh over the overflow pipe of cisterns. Cover infant cribs with mosquito netting. You should use mosquito repellents that contain DEET. Follow instructions carefully and use on arms, legs, ankles, and nape of neck. Avoid applying to children under 2 years old and to the hands of older children, and wear long sleeves and long pants when you are outdoors.